Hi, my name is Brandy Williams, and I'll be doing my fourth SOAP plan video on ocular injury. So, as means subjective, the subject was a 13-year-old African American male. He was playing racquetball with his granddad without protective glasses, and his racquetball racket hit him in his eye. Obvious injuries to the eye. There was no medical history, no medical conditions, medications. There was no allergies or past conditions. The objective, his vitals were pretty good. His BP was 125/80. His heart rate was 70 beats per minute, and his temp was 99.1. During his physical examination, it showed obvious swelling to the eye. There was pain and tenderness around the eye. Bruising was forming around the eye. The patient experienced slight double vision. Radiology, the patient was given x-rays and a CT scan. The scan showed that there was a fracture on the orbital bone. Assessment, the patient was diagnosed with an orbital fracture. The eye socket, which is made of bones that surround the eye. If the bone around the child's eye is hit hard enough, it can break. So when the racket hit him in his eye, it caused a small hairline fracture in his eye socket. So the goals is to let the fracture heal and have the double vision and swelling go away. So the plan will be to wear an eye patch over his eye for a couple weeks, just to make sure no infections can occur or anything like that. He will also take antibiotics to prevent infections, and he will take steroid pills to decrease swelling. The eye patch will also be used to save eyesight or prevent it from getting worse. After the 2 weeks of wearing the eye patch, he will work on using his eye muscles again, and he will get another CT scan to make sure that the fracture is healing nicely and that the double vision is gone or dissipating. So this is the reference, and that's it.